breast cancer do occur in males because when we are born, both males and females are born with some breast tissue. But at puberty, due to the effect of female hormones, which are present in females only, absolutely. So the breast tissue will grow and attain the size, which is not the same with males. So there will not be growth of breast tissue. But yes, little tissue is present, which is present at the birth. So definitely there is a chance that males will get breast cancer. Males will have nipple areola. So you'll have some lump that is felt underneath it, or there'll be inward turning of your nipple, or there can be a discharge from your nipple, which is bloody, and there can be thickening of the skin over the breast, or there can be redness, or there can be difference in the size of your breast on both sides when you compare. And the breast can be absolutely normal, and there can be a swelling in your armpit. So any of them, if present, it's always better to consult a doctor. Mind you, presence of any of it doesn't say that it is a cancer, but definitely you have to take a consultation. Elderly, getting old is definitely a risk factor always for any cancer. So firstly, age. And second, our breast tissue will be sensitive to female hormones, as I said. So whenever there is a condition that increases female hormones in the body, causes breast cancer. So in males, the first thing is alcohol intake. So alcohol causes damage to the liver. So normally what happens, this liver balances the hormones. So whenever this liver gets damaged, there will be imbalance of the hormones causing the female hormones to raise. So that causes breast cancer. Next thing is obesity. So what happens in obesity? The excess fat that is accumulated will get converted to female hormones. That increases the chance of getting breast cancer. And there is a syndrome called Klinefelter syndrome. So it's a genetic condition. So normally in human beings, they are chromosomes. So usually males will have XY and females will have XX. So in this syndrome, there'll be extra X chromosome, that is XXY. So because of which the testicles will not develop properly in males. So normally what happens, this testis secretes the male hormone. So whenever these are not developed, there'll be decreased male hormones and increased female hormones. That makes the breast tissue sensitive for it and increases the risk of cancer. And at younger age, when you are exposed to radiation to the chest, especially before the age of 30, like which is given for Hodgkin's lymphoma, which is a type of blood cancer. So for that, radiation is given to the chest. If that happens, it also increases breast cancer risk in the later stage. And family history of breast cancer. Even if females are in the family are having breast cancer, so that male would be at risk of getting breast cancer in the later stage. And one more thing is any damage to the testicles, either injury or some infection, or if for any reason, if the testicles are removed, that function of secreting the male hormones will be decreased. So that is again another risk factor for developing breast cancer. As I said before, excessive consumption of alcohol. So it damages liver so that the balance between the hormones is lost. So female hormones gets increased and breast tissue starts growing. So that increases the cancer. And obesity, like overweight. So that also the fat gets converted to the female hormones. Again, the breast tissue starts growing. So that is again a risk factor for getting breast cancer. And not being physically active, that is another risk factor for getting the breast cancer. So there are no absolutely 100% prevention of cancer, but there are certain things that we can do so that our chance of getting the cancer can be reduced. First and foremost is maintaining a healthy weight by balancing proper food and proper exercise. And second one is being physically active. So normally it is recommended that 150 to 300 minutes per week of moderate exercise or 75 to 150 minutes per week of vigorous exercise to be done to reduce the risk of cancer. And third, avoiding alcohol intake. It's always better if you stop taking alcohol if possible, or if you're an alcoholic, and it's always better to limit your intake to 2 drinks a day. So being healthy, maintaining a healthy weight, being physically active always reduces the risk of getting cancer.